11. Mysterious side effects. While serving in Germany with the British Armed Forces in 2005, a man known only as William went to the dentist for a standard root canal procedure. The operation went just fine physically, but something malfunctioned in his brain after he received local anesthesia. At the end of the procedure, the dentist removed William's protective glasses and immediately noticed that he was pale. And when William attempted to stand up, he struggled to stand. The dentist called his wife Samantha, who later told the BBC that when she arrived, her husband was laying on a couch and staring into space. William spent the next few days at the hospital, where he was unable to remember anything for more than a few minutes at a time. Ever since, his memory resets every 90 minutes or less. He routinely forgets that he's no longer living in Germany, that it's no longer 2005, or what his current life is like. William no longer has the ability to make new memories, and his life is essentially stuck on repeat. Over a 10-year period, the only new memory he managed to retain was his knowledge of his father's death. To cope with the complications of starting back at square one multiple times a day, his wife put a note in his smartphone titled, "First thing, read this." It explains what's going on with his mind and is news to him every time he reads it. William's condition is a true medical mystery that experts haven't been able to solve. Doctors initially suspected that an adverse reaction to the anesthesia had caused his brain to bleed. But there were no signs of any injuries, leaving them with no other choice than to discharge William from the hospital without a diagnosis. His working days were over, and he and Samantha moved back to England, where they continued to look for answers about his condition. While his behavior mimicked a type of memory loss called anterograde amnesia, brain scans showed that William's brain was still working in areas where amnesia patients typically lose function. And a psychiatric assessment ruled out the likelihood that he was blocking out memories due to trauma. William still lacks a diagnosis, but clinical psychologist Gerald Burgess suspects that the problem is rooted in the brain's synapses, which play a critical role in forming new memories. When the brain creates new memories, the synapses form new proteins. Tests on lab rats have shown that when those proteins are blocked, the creatures quickly forget anything new they learn. The possibility that these proteins are somehow blocked in William's brain is still just a theory. For now, his condition remains shrouded in mystery, and it's unclear how receiving Novocaine at the dentist brought it on. 10. Joan Rivers. Comedian Joan Rivers rose to fame during the 1960s and was a household name by the 1970s. She was still working in 2014 at the age of 81 and had no apparent plans to quit. Rivers had plenty of energy despite her age and seemed to be in decent health, which was why it came as a huge shock when she stopped breathing during a routine throat procedure at a Manhattan doctor's office in September of that year. There wasn't enough oxygen reaching Rivers' brain, and her heart began to beat irregularly before shutting down completely. She was resuscitated an hour later and was taken to a nearby hospital, where she was then put on life support. Rivers suffered major complications during the procedure from the lack of oxygen, and it left her brain damaged and in a coma. Unfortunately, she never regained consciousness and passed away a week later. A federal investigation concluded that several mistakes were made both before and during the procedure. According to the findings, staff members failed to appropriately respond to Rivers' collapsing vital signs and may have administered an improper dose of anesthesia. Authorities also failed to find a signed consent form giving the clinic permission to perform the procedure on Rivers. Throat specialist Dr. Gwen Korovin denied the allegation that she failed to obtain Rivers' permission. While there may have been some shortcomings among the staff members who treated the comedian, authorities found no grounds to hold anyone criminally responsible for her death. 9. Donna Mae Bromback. Open heart surgery is major, but it's performed often and in many cases is considered a standard procedure. Such was the case for 62-year-old Donna Mae Bromback, who had an allergic reaction to a metal heart device in 2018 and went to a hospital in Mill Creek, Utah to get it removed. Her family was relieved when the surgeon entered the waiting room and told them that Donna Mae's surgery had gone flawlessly. He said that the woman's heart was beating on its own and that her incision had been stitched up. Just Moments later, however, her vital signs began to drop for reasons the medical staff couldn't figure out as they tried to stop her heart from failing. Over the next 40 minutes, they pumped so much blood into Donna Mae's body that it amounted to almost twice the amount of blood typically found in a human. The problem became tragically clear when staff realized that all the blood they were pumping into Donna Mae was draining into a garbage can beneath the operating table. They'd somehow forgotten to clamp a surgical line in her neck and failed to notice almost the entire time they worked to try saving her life that she was losing copious amounts of blood. Just 90 minutes after telling Donna Mae's loved ones that her surgery had been finished without a hitch, doctors had to break the devastating news that she'd passed away. The family didn't learn until 2 days later that their matriarch had bled out into a garbage can. A lawsuit against the hospital claimed that the operating team had failed to comprehend that Donna Mae was bleeding to death right in front of their eyes. The litigation also alleged that Donna Mae would have survived if someone had simply clamped the neckline that she bled out of. And, according to the complaint, the records regarding the surgery were as poor, if not poorer, than you would find in a third world country. While the outcome of the lawsuit is unclear, no amount of money can bring Donna Mae back, and it's a pain her family will have to endure for the rest of their lives. 8. Lacey Correa. A beautiful young woman named Lacey Correa first made international news in 2018 when she won the Miss United Continent's Brazil beauty pageant. But she graced headlines again 4 years later for an unfortunate reason. In late March of 2022, Correa underwent a routine tonsil removal surgery. While recovering at home in the city of Mackay 5 days later, she suffered a brain hemorrhage. She was rushed to a hospital where she went into cardiac arrest and fell into a coma. Correa spent the next 2 months fighting for her life before succumbing to kidney failure. Shortly after the tragedy, family friend and pastor Jack Abreu stated on social media that Correa's parents suspected that her death resulted from medical malpractice. At the time the story broke, autopsy results were pending, and it was unclear whether the surgery caused the young woman's brain hemorrhage. A tonsillectomy is a very common outpatient procedure. Complications are extremely rare, according to the Washington Post, with fatalities estimated at just 1 per 10,000 to 40,000 patients. The cause of the medical emergencies that led to Correa's death was unfortunately never revealed. 7. Knee surgery deaths. Over an 11-day span in 2001, 3 healthy men died while recovering from routine knee surgery in hospitals throughout Minnesota. Each of the deaths happened 3 to 4 days after the procedure. 2 of the men passed away in St. Cloud, while the third man died 72 miles away in Alexandria. Authorities suspended all knee surgeries throughout the state while they investigated the bizarre tragedies. One of the patients, a 23-year-old man, was killed by a rare bacterial infection called Clostridium sordelli. The other 2 men exhibited similar symptoms, including severe abdominal pain, a sudden drop in blood pressure, and septic shock, causing doctors to initially suspect that they'd also contracted the same infection. But there was no sign of the bacteria in their blood, and preliminary autopsy findings showed no discernible cause of death in either case. Investigators never found any evidence linking any of the deaths to one another. No further cases of C. sordelli were detected in any other patients, suggesting that the man who died from the infection was an isolated case, and the other 2 patients' causes of death remained unexplained. After a certain amount of time passed without any reason to believe patients were in danger, knee surgeries resumed. 6. Henry Patel. Wilmington, North Carolina, lost a beloved community member in 2020 when 53-year-old cardiologist Henry Patel failed to regain consciousness after being put under general anesthesia for a dental implant. The procedure was only supposed to take 20 or 30 minutes, so when it dragged on for much longer, his wife Chital began to worry in the waiting room. After asking repeatedly about the delay, Chital was simply told that the staff had a crash cart and had dialed 911. According to local station WECT, investigators later discovered that the dentist, Dr. Mark Austin, had tried unsuccessfully to place an endotracheal tube in Henry after realizing he was in distress. Austin failed to even attempt CPR, and while paramedics managed to regain a pulse, Henry was brain dead from the amount of time he'd spent without oxygen. He was placed on life support for the next few days, while his loved ones weighed the devastating decision about what to do next. By then, there was nothing more doctors could do to try reviving Henry. And so, his family took him off life support and he passed away. Following an investigation, authorities suspended Dr. Austin's license for allegedly providing controlled substances to staff members and other non-patients. In her quest for answers following her husband's death, Shitow discovered that he was one of 4 patients who died under dental anesthesia in North Carolina in recent years. She also learned that during medical procedures, an anesthesiologist or certified registered nurse anesthetist is required to be present in case the patient experiences complications. But the rule doesn't apply to dentists and oral surgeons. Shitow believes that her husband might have survived if the same safeguards were in place for dental procedures. She teamed up with friends and family to campaign for legal changes that would require more oversight for the administration of anesthesia in dental offices throughout North Carolina. It would be an expensive change, but in Shitow's view, human lives are worth more than money. For now, the fight continues. 5. Carol Bryan. When she noticed some fine lines appearing on her face during her early 30s, Carol Bryan began getting Botox from a clinic near her home in Florida. She received the treatment regularly for years before switching to a clinic she'd never been to before at age 47. The clinic was highly rated, so Carol figured she had nothing to worry about. During her consultation, the provider persuaded her to try some filler injections, which are meant to add volume to a patient's face in areas that are thinning due to age. The practitioner promised Carol that she could get the filler removed if she didn't like the results, so she figured there was no harm in trying it and went along with the idea. She expected to experience mild side effects like bruising and swelling, but after getting the shots, Carol's forehead began swelling abnormally every few days and then shrinking back down to its normal size. A few months later, her forehead swelled and didn't stop growing. She returned to the clinic where a dissolving agent was injected to bring the swelling down. During the visit, Carol learned that silicone had somehow mistakenly ended up in the syringe that was used to administer her botched filler. Silicone is never used for facial injections due to its dangerous and disfiguring effects. The clinic promised to fix Carol's face free of charge over the course of regular appointments, and not knowing what else to do, she obliged. But her face only became more disfigured as the dissolving agent ate away at her muscle and tissue. The woman's skin began to sag and her forehead filled with pus. Unable to cope with her reflection in the mirror, she quit her job, became a shut-in, stopped letting friends and family come over to visit, and even thought about taking her own life. Carol spent years living as a recluse. Her daughter Sophia couldn't take seeing her mom in such a miserable state and eventually took matters into her own hands by reaching out to teaching hospitals in a desperate plea for help. Shortly after, renowned plastic surgeon Bryan took Carol's case and managed to repair a lot of the damage. Carol's road to recovery has been arduous and both physically and emotionally challenging. And while her appearance has come a long way, she's now blind in one eye and will likely never look like she did before the botched procedure. She's now using her story to help others and works as the director of a non-profit called Face to Face Healing, which is dedicated to raising awareness about disfigurements that can occur after certain medical procedures. 4. Andressa Souza. Shortly after treating herself to a bargain price lip piercing in 2022, 20-year-old single mother Andressa Souza came down with a headache and fever. At the time, there was a dengue fever outbreak in Itapora, Brazil, where she lived with her mother, husband, and young son, so naturally she assumed she'd caught a case of the illness. However, Andressa's lip also began to swell. Her mouth eventually got so big that she was unable to remove her lip ring. the piercing was infected, and by the time she went to the hospital, the infection had spread to her bloodstream. Andressa's mother told local media in Brazil's Mato Grosso do Sul state that she didn't know exactly where her daughter got the piercing done, if the business was licensed to perform piercings, or if the person who did the piercing was a professional. The young woman died from the infection after spending 24 days fighting for her life in the intensive care unit. Doctors told her mother that the infection had taken over 37% of Andressa's brain. If she had survived, her mental state would have been impaired to the point of her quality of life being questionable. Once the infection spread past the point where doctors could treat it with conventional medicine, the outcome of the situation unfortunately was bound to be tragic no matter what. 3. Paul Lau. In June 2015, 54-year-old father of two Paul Lau went to a hospital in Sydney, Australia for a knee construction surgery. The procedure went by uneventfully and with no complications. While in recovery several hours later, Paul's breathing became shallow and he began to drift in and out of consciousness. A staff member initially mistook the symptoms as signs of sleep apnea, but began to express her concerns about Paul as his condition deteriorated and his need for oxygen increased. He eventually became unresponsive, and the nurse attending to him was unable to detect a pulse. The nurse called for help, and staff members attempted to resuscitate Paul, but by then it was too late. An investigation found that Paul died from an overdose after receiving a high dose of a heavy narcotic painkiller meant for another patient. The mix-up most likely occurred when the anesthetist in charge of prescribing his medication got distracted while going through his chart. The doctor set the file down, walked away to deal with another patient and returned to his workstation. However, he forgot that he'd left Paul's file open and mistook it for the file of the other patient he was dealing with, who was supposed to receive the medication that was given to Paul. The inquest findings revealed that there were as many as 15 missed opportunities to discover the error and prevent Paul's death. And when staff members attempted to resuscitate him, they failed to realize that he was overdosing on a drug, which would have given them a chance to administer another drug that could have reversed the effects of the overdose. The doctor who made the prescribing error admitted responsibility for Paul's death, but claimed that he hadn't received adequate training on the hospital's new electronic prescription program. The inquest report noted that no other staff members seemed uncomfortable with the system and ruled that the doctor failed to pay adequate attention to what he was doing, and that he also failed to act when he should have been well aware that Paul was receiving the wrong medication. 2. Rosemary Abreu. 27-year-old mother of two Rosemary Abreu went to Lincoln Hospital in the Bronx one day in 2019 to drain a cyst on her thigh. It was a minor surgery and there was no reason to expect any complications. But for some reason, she went into cardiac arrest during the procedure and fell into a coma. Sadly, Rosemary died the next day. Her mother, Dora Restitutio, told the New York Daily News that her daughter was in high spirits when she went to the hospital. She was in the process of moving, had no major health problems, and nothing in her life seemed amiss. The young woman acted perfectly fine, right up until the moment she received anesthesia. Doctors allegedly told Dora and her son Michael Abreu that they had no idea what went wrong during Rosemary's surgery. Suspecting that her death resulted from medical malpractice or negligence of some sort, the family hired attorney Sanford Rubenstein and filed a $50 million lawsuit against the hospital. Unfortunately, there have been no major updates on the mysterious case ever since news outlets reported on the lawsuit about a month after Rosemary's death. At the time, the hospital had failed to respond to media requests for comment and has remained tight-lipped on the matter ever since. 1. Jody Watson. When Jody Watson made the decision to undergo a skin procedure called CO2 laser resurfacing, she was promised that she'd walk away looking years younger. The 36-year-old professional dog walker from Fife, Scotland, had always been insecure about her acne scars. She felt like it was the first thing people noticed about her and looked forward to seeing her new face. Jody knew that the healing process came with some unpleasant symptoms, but no amount of mental preparation could have made her fully ready for the hellish experience. After getting the procedure done, her skin was left cracked, leaking, bleeding and severely inflamed. So much fluid poured from her face that she slept with a towel around her neck to avoid making a mess. She also laid in bed with bags of frozen peas on her face in a desperate attempt to reduce the discomfort and swelling. After a few days of pain, Jody's face became extremely itchy and started peeling. She had to constantly apply and reapply Vaseline to stave off the itching. Around 5 days after the procedure, she felt much better and could see the results. She was so happy with the outcome that she cried, and she also shared her experience on TikTok. The video quickly garnered over 4 million views, with many commenters admitting that the healing process looked so agonizing that they weren't sure if they'd ever be willing to go through with it, even if it meant shedding years off their appearance. Would you rather spend 6 months recovering from a medical procedure that it typically only takes a few days to heal from, or have lopsided facial features for 3 months while waiting for some poorly done Botox to wear off? Let us know in the comments below. If you enjoyed this video, be sure to subscribe to the channel. Thanks so much for watching, and we'll see you in the next one. Bye.